Regarding today's session, the focus is going to be on the evaluation challenges in local authorities. And for that, I'd like to welcome today's host, Jo McKenzie. Jo is the Strategic Research and Evaluation Lead in the Public Health team at Hertfordshire County Council. She leads a team of 12 research and evaluation officers of various levels of expertise. Jo has been carrying out evaluation in Hertfordshire County Council for nearly 6 years and is very familiar with the challenges that can be faced when working in a real-world environment. For any questions along the webinar, please put them in the chat and Jo will pick them up by the end of the session. Unless there's a really urgent question, we're going to tell Jo about it. Without further ado, I'll give floor to Jo for the webinar. Thank you.
Okay, thank you, everybody. Hi, yes, so my name is Jo McKenzie, and I work at Hertfordshire County Council. I've been carrying out some evaluation and some research for some years, and I've come across many challenges and barriers. So this webinar is just going to be about talking about those, highlighting those that could come up, so that anybody else who's trying to work in a local authority setting will be prepared for those sort of challenges that come up and be able to think ahead about how they might be able to get around them. Okay, so just to introduce you to the webinar, so first of all, I'm just going to go into discuss the political environment. If you already work in a local authority, you'll have some idea about how that works. However, if you're coming, say, from an NHS or from a university perspective, this will be new to you. And I think it's very important that we take that into account because this does affect how you carry out evaluation and can put up challenges to any research or evaluation that you take or you carry out. We can then look at what are these specific issues that you might encounter and how these issues can be managed to try and make it easier for you as you go through your evaluation. Just finding the right slides. I can still hear that people are joining us as well. Okay, so the political environment. Okay, so the political environment, the council is run by democratically elected members. So these members are the ones who have the final say. So when big decisions are made, information is put to them and they make the decisions based on that information. And I think it's important to remember that those elected members are not from a research background. Research will be an alien topic to them. It's an alien area. It's not something they're familiar with. Therefore, they take information from the council officers and also their residents. It's the council officers within the council, it's their job to provide that unbiased information to members, which they take away and they do whatever they feel they need to do with that. I think it's also really just important to remember that those elected members will be influenced by their voters. Contact with residents is going to be biased. It tends to be that some residents just shout louder than others, some are more forthcoming than others, and other people just don't want to engage. And I think that's just the way life is. But all of those things, we just need to be aware of those when we are carrying out evaluation. Okay, so we'll do a bit about, okay, so elected members. Okay, so members are elected to wards within a county or an area of your constituents, so that your geographical area. So we have two types of authorities. Aware of Hertfordshire County Council. It's a county council. We're in a two-tier system. So we have a county council and the district councils. So therefore, we have different responsibilities. You'll also to the district councils, but you'll also get other councils which are known as unitary councils, and they have responsibility for everything. So depending on whether you're working in a unitary council or a two-tier county council or district council, there will be different responsibilities and different ways of working. So it's just important to remember that. Okay, so there are a whole group of elected members. I think we've got 70 odd within Hertfordshire. We're quite a big county, so a lot of different people, a lot of different areas, and each member is going to have contact with a different group of residents. And some of those members, when they carry out the elections and they put them all in place, they elect their leader, they'll also have some members who are responsible for a portfolio area within the council. So for example, in public health, which is where I work, we have an elected member which we share with the community safety team, and they will be responsible for making decisions, or those final decisions around public health. So I work with our director of public health. There are other areas, for example, adult social care. They have their own elected member who works alongside health and wellbeing. Children, young people and family, another area, highways and transport, the environment, growth, infrastructure and planning. They all have their own elected member, and they'll also have a deputy as well. So again, that's going to have an influence because they've got quite vocal members within their residential areas. They could effectively influence those particular elected members as well. So it's useful to maybe have a look at, say, if you're working in a different county council or a unitary council, just to try and understand a bit more about the structure and who's responsible for who. Okay, so more about moving on to actually working within the council. So again, it's very different from working within a university. So within the council, we want to be quite there. I think there's a risk of evaluation being seen as a trend, so people not necessarily using evaluation for what it's supposed to be. So getting people to understand more about what evaluation is about. So managing expectation. And I think one of the important messages, I think, with evaluation is that they're aware that an evaluation can go either way. We've had people come along to us and say, oh, we want an evaluation because we want to prove our service works. Okay, well, that's great if it does, but there's also a risk that an evaluation might prove that your service doesn't work, and they just need to be aware of that. Otherwise, they could be quite upset at the end. I think it's also important that clients know why they want to have an evaluation. Again, they hear that somebody else has had an evaluation and go, oh, well, that sounds good. They had an evaluation and they're promoting it. We want a bit of promotion, therefore we should get an evaluation, without actually thinking, what are they going to do with that evaluation? What is the point of it? They're not always aware of that. You need to be clear again about what you can evaluate as well. I think there's some unrealistic expectations. We've had people come to us and say, oh, well, we're getting a new person to do a particular job. We want you to evaluate them. Well, we can't evaluate an individual person. We evaluate a service or a project or an intervention, but not an individual person. We've also had requests about, well, we had a phone call with somebody and we provided them some advice. We'd like you to evaluate it. Again, we can't evaluate individual little bits and pieces like that. It needs to be a whole project in order to be able to do something meaningful. Again, I think there's also a misunderstanding about all the work that goes into evaluation, from the planning phase to the end of report phase. And I think that some people see evaluation as just another extension of data analysis. Within the council, we have quite a few analysis teams. So those do population analysis, for example. We have those who do more of the traditional public health analysis. And sometimes I think people seem to see this as an extension to that. And it's certainly, it's different, and it's been making people aware that how it is different. Okay, right, moving on. Okay, so just to, again, being aware of timescales when you're working in a local authority. We tend to work in financial years, so very much it's fixed on what's happening from March to April. and there's often people have a certain amount of money allocated to them, and it's like you have to spend it within a certain amount of time or you lose it. And therefore, there's sometimes it can be a hurry to spend money because they don't want to lose it, because if you lose it, there is a chance you will not get that money next year, because somebody somewhere will make a decision to think that you don't actually need that money. So that will have an impact on how you design an evaluation. Now, again, we have a problem where evaluation planning time is not often considered. This is due to a lack of understanding by some of the commissioners who're not really aware of what goes into an evaluation. So they'll either think that you don't really need to know much about what the intervention entails because it's just a bit of data analysis, or what can happen is they'll come along later on, they started the intervention, the project, whatever. So they may come along at the end and go, oh, we really should get that evaluated because that was really good. Well, that's too late because we've missed the opportunity to be able to collect any baseline data, which is really going to make it far too late. And especially if we're too far down the line, then even carrying out some interviews, focus groups, that really is too late because people have moved on in their lives. So it's really important to get that message across that if people want things evaluated, they need to think about doing it before starting the project and not come along at the end or halfway through, because then even halfway through, you've missed that opportunity to carry out any baseline data collection. So, as I mentioned, the client doesn't always seem to understand that as an evaluator, it's really important to understand what the project's about, what are you trying to achieve, how does it work, who's involved, what are those outputs, what are those outcomes. It's one of those things that they don't actually think about a lot of the time. It's a rush to get that money spent, that project in place so that they have secured that funding, and that can be overlooked. So it's really important to make sure that you understand what that project or service involves. So you will need to ask some probing questions to ask them, well, things like, well, what does success look like? And even something as simple as what does success look like isn't always clear. You'll find that, again, because they've got that money, they'll think about, okay, we're going to set up this service and do this, this and this and this, but they haven't actually thought about, well, if we do this project, how will we know we've been successful? And sometimes asking a simple question like that can be quite revealing, and you will get the project team will actually have to go back and think, well, actually, that's a really good question. I hadn't thought about that, and they'll have to go away and have a think about that. We also need to make sure that everybody is in agreement about that, how that project service works. A lot of the time, things aren't really written down properly, and then you might go in and see that something's running, and different people on the ground have different ideas about how it's working, might do things in a different way, which means that even if you did try to evaluate it, it's not really going to be very helpful when you've got effectively 3 or 4 different projects or services running under the name of one. So again, important to make sure that everyone's in agreement. Okay, so in order to make sure that happens, we have some tools that we can use. And I suspect that some of you would have come across these before, know the names. For example, we have logic models, and we have theories of change. These can be really useful to run a workshop with that project team because it makes them think about their project from beginning to end, which they may well have not done. It helps them to agree how their intervention works and make sure that they all agree about it. We do have an issue with people going, don't worry about it, it's all in my head. That's a real problem because we're not mind readers. We can't tell what's going in someone else's head. It gets misinterpreted. So by having a logic model workshop, or if you can, a theory of change workshop, which is a step further and which you'll join everything together in terms from beginning to end, show those steps, it means that everybody is then clear they have to agree about how their service works. And the feedback we've had from people who've been through, say, a theory of change workshop, they've actually realised it is actually a really valuable tool, and they've been really glad that they have actually been through that, and it means they're aware of what their problem is and what they're trying to achieve. So yes, it is an extra step that they have to put into their project, but they have reported back saying it's actually been a really useful tool. Okay, so we find people really struggle with identifying project objectives. So often we ask people to write their objectives, so they define what success is, what are your objectives, or we receive a document with a project outline, and all the objectives are a to-do list. So they're going to deliver a workshop, they're going to run an intervention. It's all about what they're going to do, to-do list, the deliverables, which is not about writing objectives. So you'll probably need to go through them and then really try and tease out what the objectives are, and this might take more than one go. So you might get halfway through, they'll have to go away and have a think about it and come back and rethink until you manage to get some smart objectives. So do allow for time for that, and it's really important that they do get those good objectives, because without good objectives you're not going to be able to evaluate well. The other problem that we come across is outputs and outcomes are often muddled up. So councils tend to be very good at output focused, but not so much outcome focused. So they'll write a list of things that they want to achieve, and it'll be around, they have the key performance indicators. So those numbers, that throughput data. So they need to get 100 people through their intervention within 3 months. They need to have X% that come from a socially deprived background. Maybe they need to get a certain percentage from a particular ethnic group or a particular age group. Again, all important, but these are outputs, and it's really important to get the message across to them that these are outputs, and they're great to have them, but they also need to think about outcomes as well. And that outcome, I think one of the key ways to describe it to them is that, well, what is going to change? What is going to change for the individual by going through your service? And that will help them to think about how this service might be successful, and then we can find some appropriate measures to go with that. So yeah, it's all about change, and it's getting that message across, because so often that's just not thought about. Then when you have your objectives, the next challenge can be data, and data can be really challenging within local authorities. From an outsider's viewpoint, you can think, oh, they've got all these lovely data sets about all this population. We'd love to get our hands on them and do some great analysis and find out all this information about people through the local authorities. It's not quite as simple as that. So there's two sides of this. Some of it's knowledge and some of it is about austerity cuts, finances. It would be great if we had some really good database systems, but if you look behind the scenes, you will find that some of the systems are really creaking at the seams. They weren't necessarily designed well when they were set up 20, 30 years ago. So again, this is where you have to sort of come to terms with that. If anyone's got any great selling skills to convince council leaders they need to invest in their systems to collect good data, then please come forward, because that would be fantastic. Okay, so in terms of understanding, many council officers may struggle with the concept of baseline data, so either people get it or not, but you might need to be prepared to have quite a few conversations about trying to explain why you need to get baseline data. I say, we all know that you need to know what the situation is like now, so you've got something to compare to when you get to the end of your project or intervention. But we have had people come back to us and say, well, I don't see why we need to collect baseline data because we haven't done anything yet. And that concept can be quite difficult for some people. So just allow for that, because that might happen. Then it's a case of identifying suitable outcome measures. So you might find that there is some data already being collected on it, but more often than not, there isn't. Again, it depends what you're actually doing at that time. If there's finances involved, it's more likely that you will have that data. But if you're collecting, say, something around sort of well-being, loneliness, one of those sort of areas, you'll probably find there isn't any data being collected. So you'll need to identify a suitable outcome measure, which may well involve asking people, finding a way of actually collecting it. So going out, collecting that data and that baseline data, collecting that follow-up data. So that's going to require resource, and just getting that resource can be a challenge because somebody somewhere has got to find the time to collect that data. So you're going to need to get buy-in from staff on the ground, because they will see that as an extra job to do, more work to do, which they may push back on. So yeah, you need to think about how you're going to tackle that. Then when we get the data, it's about that data quality. If they're collecting their data and they are putting it into a format for you, it's really helpful to advise them exactly how to collect that data, what format to put it into. You might find that they put it in completely the wrong format. A classic example is they put it in an Excel spreadsheet. The columns are not aligned, or there's no filters on them. So you might find dates, for example, somebody's put it all in numeric format. The next line, you'll find the date is then being spelt out with the month. Then you've got a full year, say 2022, the next column only has 22. So all of these things are going to mean that you'll have to put extra time in for data cleaning. And if anyone's done any data cleaning, you'll know that that is just a soulless task, and I wouldn't wish it on anyone. So have a think about maybe setting them up a spreadsheet with what sort of they call masks, which means that they have to put data in a certain way, just to save yourself the pain of having to do any data cleaning. And the other problem we have sometimes, especially if this is a commissioned service that goes out to and they collect the data for you, they then send it back in aggregated format, which means that you can't actually do anything with it. So you will need to make sure that you're very clear it needs to be an individual record format. This again might then lead to data sharing agreements, because if they're in a separate organisation, there might be some concerns about sharing individual records for data protection. So you'll need to iron that out. So you don't need names and addresses, but you do obviously need those core values for the individual outcomes. So you will need to discuss with whoever is collecting that data what you need and what you don't need, and if any data share agreements need putting in place, data protection agreements, then make sure that that is included before you start. Okay, so just talking about qualitative data, because we do have to, well, we use a lot of qualitative data in evaluation too. Two reasons for that. Often we find that quantitative data alone, either the quality is just not good enough on its own, or it's really difficult to collect, and it doesn't necessarily tell that why about a service. So it'll either tell you yes or no whether you've met an outcome or not, but there's a lot going around in terms of understanding about how that service might have worked. If we need to make improvements, what do we need to do? So qualitative data can be really valuable to us as well. So if we can, we try and encourage a mixed methods approach. So we're finding that people are now valuing qualitative data a lot more within Hertfordshire County Council, which is great. However, it is time consuming, and we have found that we do need to make sure that we have people who do know how to work with qualitative data in order to get meaningful data. Generally, I've found if people haven't got any research experience, they're not actually, there is a lack of understanding about how to actually go about collecting it, how to be able to write good questions to collect the data they need. We often find that maybe they ask the question twice, they ask closed questions, they try and ask two things in one question. So we do have to support them in writing good questions, and then how to go about actually collecting it as well. Analysis as well is something that's those who haven't got a research background tend to struggle with. I think the classic example we've had back is it's in a electronic survey or a survey, and you've got a comments box at the bottom. People write their comments, someone comes along, they collect all the comments, and then they pick out all the nice little comments that they like and say, look, it worked. All these people are really happy when your comments about, yeah, fantastic service. So-and-so was really helpful when I came along, which those who have got a qualitative background will know that it's not helpful. So therefore, you will need to make sure you've got somebody in place who has got experience of working with qualitative data, but to say it is useful. And when we have presented it to senior managers in terms of evaluation, they have found it extremely useful, and it's helped give those service users a bit of a voice, which is something, again, we struggle within a local authority, is about giving those service users a voice. So definitely something that you'd want to think about going forward. Okay, ethics and research governance. This is something we have really struggled with. If you work for a university, you work in the NHS, you'll have your own ethics process panel that's been established. You know the process, you fill in the form, you send it along to the panel, they do whatever they need to do, get back to you if there's an issue, and then they stamp it off, which is great. Within the council, that's sort of been overlooked. I think something particularly we noticed within public health is, say, public health used to be in the NHS and therefore had access to NHS ethics, but with moving over to the council, we don't have that. So yeah, it's very patchy. I know with evaluation, if it's just a service evaluation, you don't necessarily need to have ethics. So you can get around that way, but obviously we just want to be careful. If we happen to be working with vulnerable service users, we would like to be safer rather than sorry. We really can't afford for the council to be put in a compromised position with someone potentially taking us to court. So we do assess everything and say, well, do we need to go through an ethical process? Is this research? Is this just a service evaluation without vulnerable service users? So yeah, going back to the problems we've had, because there isn't anything established, we found different directorates have got something of some sort in place, but they don't align. So there is work there that needs doing in order to be able to get everything aligned. And if anybody has got examples within a local authority where they've got a good research ethics governance process, it would be really great to hear. Because it is an issue. Data protection, we have got good processes in place. We have a data protection team, and we'll fill in something called a data protection impact assessment, and they'll be able to sign it off. So that's not such an issue, but there are some real issues around ethics. And I believe that it is something that's being looked at a higher level now, because it had been noted that it's been something that's been overlooked. Okay, so going back to working with council officers doing an evaluation, the cost of an evaluation, again, I think that there's a lot of people who are unaware of what's involved in an evaluation and the costs behind it. And it sounds a nice idea. People put their business case together, it gets signed off, they get the money, but they have forgotten to put in some money for evaluation. So they go and ask for an evaluation, thinking it'll just be a bit of data analysis. Somebody can find the time somewhere to do that, which isn't really very helpful. If you're going to have someone putting a fair amount of time into doing the evaluation, you need to cost for them. So if you can find like 5% of the budget towards evaluation, that would be really helpful. So it's something that needs to be encouraged, and something that we're really trying to encourage now is to get people to think about evaluation when they put their business case in. Think about that individual, how much time are you going to need, and how much is it going to be costed for. And I think I think one of the issues that we've had, I think, within public health is that we've been working for public health. We've also been working with adult care services. Now, adult care services have been paying for our time. So they have been costing the time to use some of our research and evaluation officers, which has worked well. But whereas within public health, it's like, oh, well, there's a team there, we'll just get some of their time. And therefore, they haven't really been aware of actually the cost behind it. And I think the other thing we've found that when people do actually pay for evaluation, they listen to that research and evaluation officer and use their advice, whereas we found when it's considered just like another little free tack on, that sometimes we get pushback on some of the evaluation advice. So I think by adding a bit of a cost on it, it is actually better for you because people will appreciate you paying for something. Let's listen to it, and then we'll follow their advice. Okay, so related to cost. So sometimes we get, oh, well, we can't afford it, therefore we'll do it ourselves. Fair enough, but what we often find, if they do say they go away and do it themselves, again, whoever's made that decision hasn't again appreciated the time required for good evaluation, and haven't considered that their core project team haven't actually got the capacity to do it, because they'll still have their other work that they need to do, and then suddenly they've got to find some extra time to do some evaluation. So therefore, as evaluation is not in those persons' job description, it won't necessarily be a priority. So either you'll get a little bit or it might not happen at all. There is a risk that data might not actually be collected. They might not have those data and analysis skills. We have separate teams of analysts across the council who specialise in doing data analysis for those who are not comfortable with sitting down, say with an Excel spreadsheet and going through and typing formula in, working out, creating those pivot tables, etc. Again, qualitative data, again, it's another skill set. If you haven't got those within the project team, you're probably not going to have data that's been analysed properly, which could again skew the results. And you've also got the risk of biased results. You within the team, you're under pressure to show that you've done a good job. Therefore, it's going to be extremely tempting, and probably from the unconsciously behaviour, they probably are going to bias the results to show the positive side and less emphasis on anything that didn't go well. So there is that risk where if it's someone outside of that immediate team, the results are more likely to be less biased. Okay, so there is that fear if things don't go quite to plan. Okay, so I think I mentioned earlier that people come to us and they go, oh, we want an evaluation to show how great our service is so that people will give us more money in the future. There's that assumption that the evaluation is going to show something positive and their service can't possibly have any negative outcomes. And the thought of negative outcomes can be quite scary for people, that there is no guarantee that a service will work, something that there may be some problems with it and this evaluation might show it. So yeah, what do these negative outcomes mean to a client? So they might find that, oh, we're being criticised, our work's being criticised, that's not good, we can't have that. We might not get our service recommissioned again, we might lose funding, we might lose our jobs. All these negative fears could be going on behind the scenes at the thought of negative outcomes. Therefore, it's important to be able to manage that if there are negative things that come out of a service, and there's bound to be something. It's very rare that a service that everything 100% is going to be brilliant. It's about how to frame those. So it shouldn't necessarily mean that, yes, you're going to lose funding. But it does mean that I think for the client, they need to be able to see that this is your opportunity to improve the service, to make changes, to make it better. And I think that's really important, that's where the emphasis is. So they're actually working towards providing a service that has very good outcomes and is providing value for money. Then there is working with commission services. So not all of our services are local authority run, they are commissioned to other organisations. So if you're asking them to put evaluation into it, you've got a contract that's in the way. So effectively, if you're commissioning something out, it means that they get on with it and they do everything. Now, if you want some evaluation, you need to make sure that it's also included in that contract. Otherwise, they're not obliged to do it. It's one of those things that, yes, they can say they'll do it, but they've also got the right to turn around and say, no, we're not going to do it. So anything that you need in terms of evaluation, you need to make sure it's in that commissioning contract. Otherwise, you are going to run into problems. You also need to be just careful that you haven't got control over the data collection. So this is a classic case where we find that we get aggregated data that is sent to us, and it can be very difficult to work with, if not impossible. You also have the risk that if there's nothing in the contract, they won't actually collect data that is useful. And if they carry out their own analysis, you might find that it's incorrectly analysed as well, specifically if they're using a particular validated measure and there's a particular way of analysing it, then you might find that they haven't followed those instructions and therefore it's not useful in terms of what the findings show. Okay, so getting to the end. So just thinking about when you have managed to get to this stage, you need to think about obviously writing up that report, writing up the findings, presenting those findings. So really important to think about who your audience is. A lot of people in the council, reading an academic paper is not something that they do. They haven't got experience. You give them an academic paper and they will look horrified at it. So you need to think about how you can present those findings. Yes, you can write it up into reports. Think about the size of the report. Senior managers at the top of the council do not have the time to read 50-page reports. It's just not going to happen. So even if you do write a report that's long, think about, is there actually going to be someone who's going to read it? And make sure there is a short version. An executive summary is something fitting on a page, just over a page, is really your limit for senior management. Often they prefer to have a slide deck of PowerPoint slides. That tends to go down very well. So yes, you might have a report, but make sure you've got some a slide deck with those key points that you want to get across to the senior managers, because those are the things that they find valuable. So have a chat with them. How would they like to receive the findings? What is better to them to a written report? So I think that's really important, just to have that conversation, and also just reiterate what are they going to do with the findings, because it's all very nice, you've done an evaluation and they read the report, great, thank you, and then they put that on a shelf and it collects dust. It hasn't actually done anything useful. So we want to make sure that something useful is done with it. Therefore, ideally, you want to make sure that the findings and the evaluation link into the commissioning cycle. And this doesn't always happen where we are in Hertfordshire. And if we want to become more evidence-based, more efficient, we need to make sure that any findings from the evaluation links back into that commissioning cycle and is used in the next procurement stage, so that we have more and more efficient services. And if things that aren't working, then they're removed, they're changed going forward. So really important to try, and when you're speaking to people about the evaluation, find out why do they need it, what are they going to do with those findings, so that that evaluation has been useful, it's contributed towards something. Okay, so how to manage these challenges. So I've talked about many things that will be challenging. So you may be thinking, oh, goodness me, that sounds really difficult. That's going to be really hard work. And yes, it is hard work and there are many challenges ahead, but obviously if we want to change things so that local authorities do become more evidence-based, we need to work through these processes. So I've put together a list of things that we can work on to try and get research and evaluation as more part of business as usual. So I think it's really important to promote that usefulness of evaluation to commissioners, so they know how it can be useful, what they can do within the future, how it can feed into the commissioning cycle, make things better, how it can be used as evidence when bidding for funding in the future for services. And being clear about what the process is involved. So it's not just about some data and analysing it, it's about the whole planning, thinking about what the questions are, what success looks like, what data to collect, etc., how to present the findings at the end as well. And how is that evaluation useful to them? Keywords or key phrases particularly that we have is about value for money, more efficient services, doing more for less. These are all the phrases that we keep hearing over and over again. And this is how evaluation can help, because it's showing whether something works or not. If it doesn't work, you need to do something about it. Efficiency. If you're getting really good outcomes, then you know that it's more efficient. If you're not getting good outcomes, that's not efficient. So again, evaluation can help you to discover whether you are providing value for money or efficient services. And it's an ongoing process. You can't just do it once. You do an evaluation workshop, think your job's done. No, it's not. You need to keep doing it. Staff come, they join the organisation, they leave. We get new people who haven't got experience. You have to keep going over it so that you catch the new people to continually keep on top of that, those staff changes. Okay, so that is enough from me. So I think now's the opportunity to be able to have a discussion, ask any questions. I mean, you might have been trying some evaluation where you are. It'd be really great to hear what you've been doing, and if you've got anything that you can contribute, some good or bad experiences you've had. So, Yasmin, have we got anything in the chat at all? Or does anyone want to put their hand up? And I don't know if they can do hands up, or does it all be in the chat?
We haven't got anything yet, but I think someone is typing right now, and yeah, we have someone's hand up.
Okay.
So Ramya, if you want to unmute yourself.
Yeah, thanks very much. That's really, really helpful.
Okay.
I've just started a piece of work looking at evaluating a strategy in Luton. I just had a couple of questions really. Do you have any advice on how to go about evaluating a complex intervention, so with multiple components? And then secondly, have you found that you've been called in to evaluate when an intervention isn't yet fully formed or starts to change after the evaluation process has started, and how would you overcome those challenges? Thank you.
Right, okay, so yes to all of them. Okay, so if we take the first one, you might need to remind me of the second one. But complex, yes, we have. We've had, you're working in a council, things are often complicated. So again, it's thinking about what sort of approach you might want to take. I think with complex, again, this is where things like theories of change can be really helpful. So you can start getting maps down about how things potentially will work. You might need to create more than one theory of change. There might be several outcomes. There might be different groups. And if it is really complicated in terms of different groups, you might want to think about looking at something called realist evaluation. There's been quite a bit written about it, but this is where you're looking at different contexts, different change mechanism, different outcomes depending on different groups of people, because what works for one person might not necessarily work for another. So I would suggest having a read about some realists and have a look at some of the ways that they go about or suggest about doing evaluation. And again, that can be a mixed methods approach. It can be quite challenging, so you might want to get some help, but I would definitely have a look at that because it can be really helpful. Okay, the second question about changing, isn't it? Things that change halfway through. Unfortunately, this is the real world. It does, yes, it does happen on a regular basis. So again, it depends really what changes. Yeah, so it's what changes how does it change? Obviously, it's making a note of that and what sort of data you're collecting. But yeah, it's something that you do have to obviously make a note of when you are doing writing up, make a note of when things change, why did things change? And I think it's one of those things in judgment call, depending on how much data has been collected before it's changed. If there's a lot, or is it quite early in the beginning? If it's very early in the beginning before you collected much data, then maybe, yeah, you're going to have to discard some of that data. So yeah, it's a bit of a judgment call, but unfortunately, yes, it happens all the time within the council.
That's really helpful. Thank you very much.
Okay.
Joe, so there's another hands up. Stephanie, do you mind unmuting yourself and asking the question, please?
Hello, yes, thank you very much. I've also popped a question into the chat, but they're two different things. So the one in the chat is about the difference between logic models and theories of change, and whether you might have any examples of those that you can share. And the other question is,
sure.
Great, sorry, should I just give you time to answer that one?
Yeah, but yes, okay. So logic models and theories of change. I know we've had some workshops on logic models. They're quite popular. So there might be some slides around somewhere going through what a logic model is. Logic models tend to be, they are related in some way. I think logic models are more simple, and if people are unsure of what they're doing, they're a good place to start. But you've got your columns thinking about what your outcomes are. You look at your outputs, you look at your activities, what your resources are, and then what the problem is, and you put them in these different columns so that it can show how you get from your problem to your outcomes. You might have the outcomes split up as in short-term outcomes, long-term outcomes. You have your line of accountability, etc. So they're very useful if you still need to put sort of more details at the beginning phase of planning out an intervention. And so that there's lots out there, and we have done workshops on theories of change, on logic models before, within, I think, this group, or certainly when PHE was running them. Theories of change tend to be more detailed, so I'd say they're more of a step on. So this is where you're looking at the individual blocks. So you're explaining how you get from A to B, so you're writing down the path. So there's no little blurry bits in the middle where something magical happened and everything resolved itself, because we all know that that doesn't happen. It explains those clear steps from A to B. How did you get from A to B, from the problem to the solution, step by step? So you can identify any barriers, any enablers, what that mechanism of change is in the middle. So theories of change, they're unique to your project. It's not a standardized one. I know you do get, like, say, behavior change models, which are standardized and being tested, but these are very much so individual to your project, but they really help you and your team understand how your service works, and what that mechanism of change is, and then once you've identified that mechanism of change, or several of them, that's when you can start looking at how you're going to measure it. But I think theories of change and logic models is actually a separate workshop on its own.
Okay, that's great, thank you. And the very different question is, I work in a local authority, and we've also recently had discussions about evaluation that's going on within the team, and how can we increase our skills. So I was just wondering whether there are any programs where, for example, local authorities can get evaluation training for free, basically.
Right, okay. I mean, that is something that Fresh is looking at, and say there will be more sort of like workshops that come across. There is Andy Jones is doing some individual workshops as well. So maybe it's, if you've got something particular, you book a session with Andy and he can go through it with you.
Okay, thanks. I was thinking sort of along the lines, you know how in IHR sometimes there's these big programs where you can get evaluations for free, and I was wondering whether there might be something equivalent that you can get evaluation training for teams.
Yeah, I mean,
Okay.
it's the sort of thing that Fresh would be looking at, and there are plans in place to put a program of events on. So obviously just keep an eye open. the events. I just realised the last one here. Yeah, there are some events here, so you can follow the link, and we will send out the slides, and there will be links on the end of the slides as well to follow up. But there will be further things that come out, and occasionally you find that some universities put on some things, so it's a case of having a look round.
Okay, thank you very much.
Okay.
So we just have 2 comments in the chat. One from Nettie. She says it has been very helpful, especially from her moving from the NHS to the local authorities, and specifically the part where you discuss the governance and the ethics. Also, Louise has mentioned that it's been really interesting presentation, and she commented that the Essex County Council have an internal research team who provides the governance assurance for evaluations and work with external partners. But Louise had to leave, so she just left that comment. Yeah, do you wanna wrap up anything, Joe, or do we just wrap up this session?
Okay, we can do. Okay. Is that a legacy hand, isn't it? I think that's still there. Right? Okay. Yeah. Right. Okay. So yeah, I mean, obviously it's an ongoing process. We're learning all the time. So hopefully, say in the future, we'll have learned some more. Maybe you can have some other opportunities for sharing advice and maybe shared challenges about trying to do evaluation within a local authority. But I think the key thing here is just to remember that you are working in that political environment, and you're always going to have political challenges. And it is a long-term culture change. And hopefully, as time goes on, we'll get more and more used to carrying out evaluations in local authorities. Commissioners, senior management in the local authorities will get more used to it. They'll see the value of it, and it'll be something that they become more familiar with, and it'll be easier to work with. There will always be problems, though. Yeah, you're never going to eliminate problems. I think working in a political environment, in a forever changing environment, we're on the ground. And you have to adapt depending on what the situation happens to be. But yeah, if anyone does want to get in contact with me, then feel free to contact me. My email address is joe.mackenzie@hertfordshire.gov.uk, and we can send that out with the slides.
Thank you, Joe. It's been a great webinar.
Okay, thank you.
Thank you. I'm just reminding everybody with the drop-in clinics, if anybody has needs a personal advice or guidance on the evaluation, they can be directly in touch with the Professor Andy Jones, the public health expert advisor in Norfolk County Council. Thank you all for attending the webinar, and we'll be sending the slides later. Thank you.
Thank you.